Hello and welcome to another video in this series on how clean language can help in any kind of mind-body therapy. Today I'm with Tamsin Grainger, a colleague of mine who's been teaching and practicing Shiatsu in Edinburgh, based in Edinburgh for the past 25 years. And Tamsin's going to talk to us today about one of the most challenging situations we can face as mind-body therapists, and that is working with people who are close to the end of their life. So Tamsin, maybe we can just start by asking, what are the main issues for you when you're working in these kind of situations?
Working in these types of situations can be quite overwhelming when you first start. That's what I felt when I first started, because they come with so many reasons why they want help, why they want Shiatsu. So first of all, I needed to start to learn about the types of cancer that they've got and the sort of serious condition that's brought them to the hospice. Then I realized that, of course, there's all the complications about medication. And then in addition to that, I don't think I'd quite realized that there would, of course, all the old symptoms that may be physical, maybe mental, maybe be spiritual or emotional, are also still there. And they're having to manage their own feelings and response to what could be a very sudden diagnosis, and all the responses of the people around them as well. So it's a really complex picture that they bring.
So Tamsin, you're working not just with the medical and the physical symptoms, but obviously also with emotional, relationship and spiritual issues. So how does the clean language, these simple, clean questions, how do they help you to kind of cut through that complexity?
You're right, Nick, that it's very complex, and clean language helps me, particularly if I can't do a hands-on diagnosis, for example. That might have been the place I would have gone to in the past if somebody was lying on the mat. But these people are often not able to lie down, or have physical reasons why touching the heart or touching the back is not good for them. So clean language for me, because especially there's a lack of time in these situations as well. Of the sessions themselves are much shorter than the normal sessions that I would do in a clinic situation. Then I can use clean language to really try to identify what for them is the core of why they're there and what support they need.
And could you give us an example of how it's helped in any particular case?
Yes, Nick. I was remembering an older woman who I worked with. I'd used clean questions to identify that actually she wanted help with her arthritis rather than with breast cancer that she had. So physically, after one session, she was happy, saying that she could walk from the kitchen to the front room, for example. So that was great. But in the second session, she started talking about her personal relationships, about how difficult members of her family were finding managing the idea of her not being there for very long. And within that session, she started talking about what's important in her life, what was important about the things which hadn't gone well when she was reflecting back. And we got to, using the clean questions, we got to a very deep place very, very quickly. It was very moving.
Thanks, Tamsin. And is it okay if I ask you a couple of clean questions about what matters to you about this kind of work?
I'd be really interested in that. I know I've been drawn to doing this work now for a number of years. I'm really engaged with writing about it just now and teaching about it. But it's doing the work, it's doing the Shiatsu in the real life situations that makes me ask myself, why am I drawn in particular to this type of work?
Is there anything else about being drawn to this type of work?
I think there's something about helping people to I need to really just let this sink in. Helping people to find a way to be exactly as they want to be at the end of their life.
And for them to be the way they want to be, how do you need to be when you're doing this kind of work?
I need to be even more centered and even more contained within myself to do this type of work, Nick. Clean language is particularly important because I can't overlay what I feel or what I think with their responses, and so it really helps me in that ability to sit, to be, to open, and to hear them.
Thank you, Tamsin, for sharing that personal side as well as the more clinical side in this really very sensitive kind of situation.
Thanks, Nick. It's a great opportunity to think about it from my perspective, as well as to keep learning about this type of work. I appreciate it.
Thanks, Tamsin, and thanks to you for watching another video in this series on how clean language can help in mind-body therapies. Thanks very much. See you next time. Bye.